We have a clip that can you tell us what we're going to see in this clip that you brought along?
Sure. This is really the preliminary effort that we're attempting to do. In addition to the humor and relaxation, I also discovered, actually, and this was from a visit to Stanford University Medical Center, they have a very active hospital musician program. Oh. And I was not even aware of the fact that you could possibly bring live music, real musicians, guitarists, harpists, pianists, keyboardists, up to the floors, sometimes even at the bedside. We've had some extraordinary stories of musicians being present even during the dying process, a transition with family members. I mean, you try to watch, but I mean, tears will be streaming. It's a very emotional.
So we're going to see the musician.
We're going to see a little bit of one of our musicians, Rita Phillips, I believe. She's a keyboardist. She writes all of her own music, and just to kind of give you some idea what this entails.
Okay, why don't we show that clip?
Okay.
Women having their babies, and it's a lot of running around, and once the music starts playing, it's just a great stress reliever. It just makes everything slow down.
That would actually be nice.
Little zing of music, it helps kind of bring things up when you need it and calm when you do need it that way too.
Don't stop. The music is so important to everybody. Thank you so much for having this.
It helps the mind to put things in better perspective.
That's wonderful. I mean, that is such a positive thing that you're doing.
Thank you.
I almost feel like I need to get sick so I can go hear these musicians, but I don't want to do that.
Yeah, we're not trying to encourage that, but and also just to mention, we're showing Rita Phillips here, who's playing piano. However, we have 6 professional musicians. They are all phenomenal in their own right. Very different styles. We have a number of guitarists. We have a classical Spanish guitarist. We have a light jazz. We have harpists, Celtic harp, and it's phenomenal.
And you also have, don't you have pets and artwork and massage and...
Right.
I mean, you're hitting it from a lot of different angles, right?
Well, initially when I first started to give my talk, I was obviously very much focused on the Norman Cousins, Patch Adams approach, focusing on the humor and all of the various things that humor can supposedly do for our health and to enhance the healing process. I soon realized that we don't always feel like laughing. And even though I was interested in it, there's some days when you're just not in the mood, and even interjecting a little humor can sometimes backfire. Mm-hmm. So I thought, how can we tap into this inner healing mechanism, which I think we all possess, through other means? And I thought if we sort of tap into the senses, to sight, sounds, and so forth, what are some things that really, I guess, hobbies, interests that I always enjoyed? I thought music, art, and animals, pets. So we have therapy dogs that come in now and then. They come in, obviously they're very well trained. No pit bulls or Dobermans.
I thought you might say that.
That would backfire. And it's just incredible. Little tiny interventions of kindness.
And
of
are you
loving
noticing results? I was going to ask you about. I mean, we have some documentation about the relationship between humor but are you seeing that on a monthly basis that this stuff really makes a difference and people are?
Yeah, it's a good question. When I first started, I felt this need, probably because I have a basic science background, and as a physician, you go to a typical American medical school, everything has to be studied, double-blinded, randomized, and so forth, and you have to show statistics. And in fact, there have been studies in the medical world, believe it or not, down at Loma Linda. They've actually hooked up people watching a humorous video versus people just sitting quietly, drawn their blood every 10 minutes, a very pleasant experiment. And they basically, and they have one group watching funny stuff. It turns out that the laughing group has a boost in the immune system, a variety of IgA, different types of antibodies, natural killer cells. These are circulating white blood cells which can actually destroy virally infected or even tumor cells. And I got very interested in that side of it, but I have soon realized that probably the most important factor that I'm looking for in the hospital setting is that everybody is anxious, everybody is stressed,
of course,
not just patients but also staff. And what I have noticed with the humor interventions, but especially the music, is we have had an avalanche, just an explosion of positive comments and special little stories and situations which have arisen because a musician has arrived just at the right time. So I think a lot of what I'm trying to do is just to alleviate that sense of helplessness, that feeling of out of control that many patients have when they enter the hospital.
That's incredible. Let's take a step back and just talk about the field of pathology, what a pathologist does, and what it takes to become a pathologist or even an MD, if somebody's thinking of following that path. And then maybe we can get back to the humor part. But
Sure. Well, as I alluded to in the very beginning, most people have the impression that pathologists do predominantly forensic pathology, and as attested by the proliferation of forensic shows, CSI, Jordan Crossing, Forensic Files, you name it, and they're excellent shows. I watch them, but I really don't do any forensic pathology. I did a 1-month rotation. That was enough to turn me off for the rest of my life. But you got to do these things when you're in training. But I predominantly, and I think most pathologists in the Bay Area, if you go to a typical community hospital, we do predominantly what's called surgical pathology, which is the examination of diseased tissue samples. Any biopsy or surgically removed piece of tissue, say a woman may have a breast cancer and she'll have the breast removed, or have what's called a lumpectomy, a limited resection. Somebody may have a colon cancer, a polyp, they may have a segment of their colon taken. I'm the guy that gets all of these samples, and I have to figure out what it is exactly.
But it's a lot writing on it to make the correct diagnosis, right? I mean, whether something's benign or not, that's huge, isn't it? I mean, your determination. Exactly,
and I'm glad you brought that up, because when I give my lectures on humor and healing, and the introduction of humor into the workplace, which has actually gotten a tremendous amount of press. I mean, if you go on the web, there's a lot of that.
Right, yeah.
I make it very clear that I'm a serious health professional. I want to get the right answer. I don't want to make any mistakes. But there's a difference between taking your job seriously and taking yourself lightly. So people sort of come away with that message. But you're right, there's a lot riding on this. I mean, sometimes I'm looking at a tiny little thread of tissue, say from the prostate, which may be 5 millimeters long and a millimeter thick. And on the base, if I call it cancer, a guy may have his prostate removed, or a woman may have her breast removed for a breast tumor. So there's a lot riding on it, you're right. And it's all based on patterns. Like I said, it's like going into a modern art gallery. We're looking at the arrangement of cells in the tissue. I'm not looking at numbers. They're not arrows pointing, here's the lesion, this is where it is. So it can be very stressful, which reminds me, I probably put together a lot of this healing arts program, not just for patients, but
I was just thinking,
to deal.
Because, doctors, you're so involved in such, it is life and death. Right?
Yes, that's right.
And you need to get a little distance from it, and humor allows you to take a step back. So even for yourself, for fellow physicians.
Exactly. And, just to make the point that the type of humor that I'm trying to promote is not laughing at other people's expense. I try to avoid sarcasm. I try to tell audiences, if you're going to laugh at somebody, laugh at yourself, self-deprecating humor.
Right.
But absolutely, I discovered in the very beginning that when we put the musicians up on the floors, clinicians could be having a frenetic day, that something terrible may have happened, but as soon as the music starts, somehow they're able to recenter and refocus. I mean, it's magical sometimes. And we're not talking about giving them medication, having a drink. We've had some miracle stories in the psych unit, behavioral health. Occasionally patients can get very agitated. They send in a harpist or a guitarist, and within 5 minutes, it's almost like dropping a warm blanket over the whole place.
Wow.